Hi, thanks for joining us today. I'm Dr. Theresa Grover. I'm the medical director of the Neonatal Intensive Care Unit at Children's Hospital Colorado. And I'm here today with Jessica Bennis, who is our neonatal nurse practitioner clinical manager. And she's here to talk to us about our nurse practitioner program in the NICU.
Hi, thanks for having me.
Thanks. So can you tell us a bit about the neonatal nurse practitioner program here at Children's Colorado?
So we have a large group of nurse practitioners. We're now an NNP team of 110 NNPs. We practice all throughout the region, as far away as Steamboat, but really cover the Denver metro area and the Front Range heavily. We currently practice at 12 clinical sites. Within those sites, we do, like I mentioned before, care of the newborn all the way up, as long as they need to remain in the hospital under the age of 3. And we really provide the care in the community settings to try to keep babies with their families and keep them as close to home as possible, if we're able to do that safely without needing to transfer them to a tertiary or quaternary center, which we would do in collaboration with neonatology. So the program as a whole, we provide the care of infants in the community, and we're there for emergency services at delivery, attendance at delivery, really admitting them to units, monitoring them, and being available if they're in, their mom's room and something happens. We're available 24/7 in-house. But we're also there to support the staff and provide education to nursing staff and make sure everybody's at the top of scope, really, for being able to function under NRP guidelines and perform emergency services on babies in the event that they would have an issue, and really just provide that extra little bit of care they need if they're not able to go home straight from delivery.
Can you tell me a little bit about what types of providers and staff that you collaborate with at these different sites?
Yeah, so a lot of the birth centers, we work very closely with the labor and delivery nurses, keeping track of what's going on with mom and labor so that we're prepared to come to the delivery if necessary. And we know what's been going on, so we know if the baby's had any trouble inside of mom, while it's still inside of mom, and that might need our services at delivery. And then we also work closely with the newborn nurses postpartum, and as they're caring for babies on the floor, if they have questions that come up. And then definitely in the level 2 and higher units, some of it is day-to-day management, working through the nutrition needs of the baby or their ventilation needs with the team the medical team that's on, and that team varies. That team can vary from a family practice physician that's working in the group, a hospitalist with a pediatrician background, a private pediatric group, or also the neonatologist. And at any time in any of the settings we're in, if we need to collaborate with neonatology, they're just a phone call away. Each of our units has a medical director that we can contact frequently, but we can also call in and talk to the neonatologist on 24/7 at Children's and relay any kind of situation that we're having, just to kind of bounce ideas off and see if it's safe for the baby to stay where we are.
That's great. And can you tell me a bit about what's unique about that program here?
It's a year-long program that we've developed. They transition out of nursing school or NNP school, and what happens is they're able to go right into the NNP field. We found historically that with licensure and credentialing and board certification, it's taking NNPs 6 to 8 months after graduation to actually start practicing as an NNP, which I think is a hindrance when you go from clinical practice to then back to the bedside and waiting to be able to start your role. So we created this program that after they're board certified, they're able to come in and start working as an NNP under their RN license, training, taking care of patients. So they start out with a 16 to 20 week orientation program with a dedicated preceptor, and they're able to start out with a few number of patients and work their way up to a full team of patients by the end of that 20 weeks. At the end of the 20 weeks, they're able to go out on their own and function alongside of one of us. We put them in units where there's always another NNP on with them so that they can collaborate with them. And then throughout the course of the year, we support them through mentorship, dedicated didactic courses that allow them to focus in on educational topics that weren't necessarily a part of their program, such as complex discharges and more in-depth nutrition knowledge and pharmacologic knowledge. And we rely on experts within Children's to really provide that education. It's not just from our team, but we seek out the experts in children's to come in and provide those classes. We really hire in a cohort model, and we allow that cohort model to determine what the needs of the classes are. And then throughout that time, we also have something that we've developed as a high fidelity simulation skills day. So we put them through our sim lab here at Children's and go through some simulation scenarios. And then we also review and practice every skill and procedure that the NNPs are qualified to do. And then at the end of that year, we've supported them throughout the year to also complete an evidence-based project. And they find a topic that they find interesting or they want to investigate more and potentially change practice. We work with them on that. And then at the end of the year, we hope that they'll be presenting or implementing that change if it's something that we're able to do. And then just throughout, we really rely heavily on surveys and feedback from them and what they need to support them really as they transition away from that bedside RN role into the professional advanced practice role.
That's great.
Yeah, thanks.
Great. Thanks so much for all your information about the program, and thank you for joining us. I hope this has been informative. If you have further questions, please feel free to visit our website.